Kim Townsend, President and CEO of Loretto. The world of long-term care is changing, and this will have impacts on the future of care in Central New York, as well as the future of Loretto. Federal and state health policies are driving the market towards what's called clinically integrated health systems, where facilities across a continuum of care jointly manage a person's care to more efficiently move patients out of the hospital faster, to lower cost settings like the services Loretto provides, and ultimately back home. This presents new opportunities for Loretto, especially with our high-quality rehabilitation programs. And by coordinating care delivery with local acute care providers, we can achieve lower lengths of stay for the patient, reduced hospital readmissions, and lower costs, all with higher quality. As our population ages, the demands for state and federally funded healthcare programs, Medicaid and Medicare, and for the services Loretto offers to the community will be greater than ever. But we must also be prepared for one of several futures with Medicaid and Medicare. For example, if Medicaid expansion is repealed, New York counties will lose over $500 million in direct funding for this program that helps to create quality, affordable health coverage, including for the services that Loretto provides. And as more complex needs increase, systems like Loretto need to be more innovative in providing care to populations beyond what we think of as the traditional long-term care resident. These individuals have more complex health and even rehabilitation needs, behavioral mental health and substance abuse issues, or bariatric care needs. And these are residents who require higher levels of clinical care. Loretto's focused training builds the specific skills of our staff that are required for these different and increased needs. Alzheimer's and dementia is another growing issue in our communities. This will require more specialized services, facilities, and training for providing memory care. Loretto will be actively investing in the years to come to become a national leader in providing state-of-the-art care, programming, and residences for this growing population. But our programs are being stretched to their limits as we try to care for a larger population that's living longer, while also dealing with a nationwide shortage of nursing staff. While healthcare systems across the country are trying to find ways to attract and retain nurses, Loretto is investing in our current and future employees by funding up to 90% of the education costs for CNAs and LPNs to pursue advanced degrees to build a strong RN workforce for the future. And we're working to increase the number of Medicaid-eligible assisted living program beds at several of our facilities, which will also help us fulfill our mission of providing care for families and individuals at all income levels. You're also going to start seeing managed long-term care become the main form of insurance through programs that offer all medical services under a single payment, which will cover all of the patient's needs, like PACE CNY. Because of the depth and breadth of our services, as well as our responsiveness to market demands, Loretto is well positioned to be a leader in the Central New York region. Loretto touches the lives of more than 7,000 residents and program participants annually. We're advancing the skills of our staff, investing in our facilities, and innovating our clinical and recreational programs not only to meet the needs of the community today and in the future, but also to make this care more affordable. Of course, there are challenges, and we continue to watch the state of potential issues like the repeal and replacement of the Affordable Care Act, while we're also creating opportunities to secure the future of long-term care in Central New York. We are excited to be on this journey and to help shape the future of healthcare in our community.